Hi, Mitchell. I want to start by saying thank you for completing the simulation. You did a great job performing under pressure during the scenario. We will now touch on the objective of this simulation, which is to demonstrate the ability to initiate prescribed enteral tube feeds safely. I have pointers for improvement, so let's discuss how this simulation experience went for you. I provided you with a copy of the performance evaluation tool and how I graded you, so together we can talk through the things you did well and what areas are open for improvement. I want to be transparent and let you know that this is a safe space for voicing opinions, concerns, and questions about the learning discussion. Starting with preparation and professionalism, can you walk me through the beginning of the simulation and how you think that went?
Yeah, so the beginning of the simulation I think went well. I gathered all supplies after verifying the order placed by the provider, and I did introduce myself to the patient. I do see here on the evaluation tool that I did not perform hand hygiene, and looking back, I did forget to use hand sanitizer upon entering the patient's room. My mistake, but I do know that this is important for infection control, so going forward I will make sure that I am utilizing hand hygiene practices when entering a patient's room.
Yes, that's a good observation. You acquired all appropriate supplies, including formula, tubing, water, pump, and syringes to initiate the tube feeds. You also did a good job of introducing yourself and verifying the order to initiate tube feeds to the patient. Although you did not complete hand hygiene, it seems you have recognized the importance of doing so and how it can cause infection. So let's move on. Discussing patient identification and safety. You ensured to explain the procedure and verified the right patient with at least 2 patient identifiers and also confirmed the patient's allergies. So great job. Before we administer tube feeds to a patient, can you explain to me why it's a safety concern when the patient's head of bed is lower than 30 degrees?
Yeah, that definitely a safety concern because it puts the patient at a higher risk of aspiration if their head of bed is lower than 30 degrees. I'll be honest, under the stress of this simulation, I did forget to consider the patient's head of bed before administering tube feeds. Although I did notice it was elevated, I really need to verify the correct degree angle. I'll be sure to be more aware of this in the future.
Good. The patient is not safe when we are administering tube feeds when the patient is lying at an angle of less than 30 degrees. I understand the simulation can be stressful and students often forget to do tasks when under pressure, so you're not alone there. When administering the tube feeds, a couple of things stood out to me, but I'd like to hear your thought process when you are hanging the formula and areas you see for improvement.
So when I was hanging the tube feeds, I spiked the formula bottle and primed the line without the presence of air and labeled everything correctly. After attaching the feed to the patient, I verified the rate of administration and programmed the pump to the correct rate. After starting the tube feeds, I did notice that I had started the wrong type of formula. I spiked, hung, and started osmolite instead of the prescribed order for glucerna. By the time I realized the simulation was almost done and it was too late. I'm sorry about that. It's just an honest mistake.
You performed the skill of spiking, hanging, and programming the pump at the correct rate perfectly with ease, but starting the proper formula is essential for these patients. You do not have to be sorry, mistakes happen. I would say if this happened again, be sure to stop the incorrect formula, make the physician aware, and rehang the correct bottle with the new tubing. I also want to make a note of checking the patency of the feeding tube before starting the tube feeds. This ensures the tube is in the correct place and it isn't obstructed, allowing for the feeding to flow safely and effectively. After administering the tube feeds, you did exceptionally well by performing hand hygiene, monitoring the patient for symptoms of intolerance, and correctly documenting in the patient's SMART. So outstanding job. Tell me about your strengths in communication during the simulation, and what do you think you need to practice on?
Yeah, I think I did a good job of introducing myself to the patient and was clear about the skills I was performing during the simulation. I felt confident in the information I was providing to the patient and maintained a respectful manner. I'm realizing I kind of ignored the patient's friend in the room, so I can improve my communication skills by making sure I acknowledge everyone in the room instead of just the patient.
I did observe you using clear communication skills. You were thoughtful when explaining all the steps to the patient in the process of hanging the tube feeds, and you did demonstrate confidence throughout this scenario, so great job. Confidence is an important thing to carry with you in a room when caring for a patient because 1, it helps build trust with your patient, and 2, it reassures them that they're in capable hands. The only thing I would note regarding communication is ensuring the patient is okay with the friend being present during the explanation of plan of care. We want to be sure that patient privacy is respected. Based on the performance evaluation tool, you did not meet competency in the skill of initiating prescribed tube feeds safely. Moving forward, you'll have to come back in at a later time and meet competency. I do want to highlight how well you did. There are just minor improvements that need to be made for the second simulation, and I do think you'll excel the second go around. With this feedback, do you feel you have a better understanding of how to meet this objective? And do you have anything else you'd like to share about how this simulation went?
Yeah, I felt confident going into this simulation, but after hearing feedback on ways to improve, I know I'll have more confidence that I'll be better in this second attempt. I'll take this feedback home and reflect on it, which will help me meet competency and continue to grow. Before my second attempt, would it be okay if I email you if I have any questions or concerns?
Yeah, Mitchell, that sounds like an excellent plan for your second attempt. You can always email me or stop by my office during my office hours if you have any questions or concerns. I will see you next week at the second simulation attempt.